All right. Hello, everyone. Thank you so much for joining us today. And welcome to our first Best Cares of 2025. My name is Hannah Peters. I am a dietitian with Best Health. We do have a few little announcements. For our Baptist team members, we do have some great programming coming up this spring. So please be looking out for those, and we will be adding links to them in the chat as well. If you are a BPI team member, please be sure to complete your biometric screening by March 31st if you want to have the most chances to win the raffle. All right, we have an incredible presentation for you guys today. It will be recorded and added to the Best Health SharePoint afterwards. So during the presentation, if you have any questions, please add them to the chat. We'll try to get to them at the end if we have time. I would like to introduce you guys to Dr. Alexander Jankoff. He is a seasoned medical oncologist with 25 years of experience in treating brain tumors, breast cancer, colon cancer, and other GI malignancies, as well as hematological disorders. Since joining the Baptist Cancer Center in 2011, Dr. Jankoff has been deeply committed to longevity science and is a compassionate advocate for healthy living. All right, welcome, Dr. Jankoff.
Thank you, Hannah. I'm really excited to be with you guys today and to give you a presentation on colon cancer, especially at the beginning of March, which is a really important month because it's a colon cancer awareness month. As you can see, I'm wearing a blue shirt. I hope you can see my screen. Can you?
We can't see it yet.
Okay, so rising colon cancer rates in young adults, is your sedentary lifestyle to blame? In Y2K, it's been a quarter of the century when Katie Couric made a history by having a colonoscopy live on national TV. And she did it, she became a passionate advocate for early detection of colon cancer after she lost her husband, Jay Monahan, in 1997. He died just 9 months after he was diagnosed with colon cancer at age 42. And after that, we still call it the Katie Couric effect. The appointments for screening colonoscopies rose by 20%. Current guidelines have been changed some years ago, and it's now 45 years or sooner. If you have family history, it's time to do screening colonoscopy. So I save these headlines from time to time, and what's been going on in the news is really disturbing kind of trend, colon cancer, and headlines about young people having a colon cancer. And as you can see here, this has been going on. Just most recently, a month ago, there was another article about why so many young adults are getting cancer, raising the concerns about ultra-processed food, sedentary lifestyles, and 25 years ago, Katie Couric took it to the national TV to passionately advocate for screening for colon cancer because her husband died of colon cancer just 9 months after diagnosis at age 42. And ever since, that's been known as the Katie Couric effect. For people who are a little bit younger, you just have to know that age is now 45 years when it's recommended that you have screening colonoscopy and or sooner if you have family history. So what's been going in the news lately is that we are having a lot of headlines, at least in my news feed, of younger people having a colon cancer and what an ordeal that has been for them. And every month you can have a new article about this. In the more recent memory, we have this tragic death of Chadwick Boseman, who died at age 43. He was originally diagnosed at age 39 with stage 3 that progressed to stage 4, unfortunately, and he passed away after a 4-year battle with colon cancer. So how does this look in the clinic, on the ground in the clinic? I'm just going to give you 2 cases briefly. A 29-year-old young lady who was admitted urgently with signs of bowel obstruction and 9-month history of worsening symptoms of abdominal pain, on and off constipation, and diarrhea. CAT scan showed mass in the mid-ascending colon. This would be around where the purple patch here is. And preoperative colonoscopy showed obstructive mass in the ascending colon, which is this area of the colon. She required urgent extended right hemicolectomy with a lymph node excision, and surgeon at that time found extensive retroperitoneal spread. Pathology showed colon cancer, which was MSI and DMMR negative. This is a test that shows us that it's likely not of genetic origin. Unfortunately, when a CAT scan of the chest was performed, it showed multiple left lower lobe pulmonary nodules, which unfortunately turned to be metastatic on biopsy. So she was diagnosed with stage 4 colon cancer at age 29. The rest of the medical history is negative, except for slight obesity, no family history, no comorbidities, and as usually people are quite healthy this early in life. So 5-year relative survival by stage is only 15% at this diagnosis. Another case, another patient of mine, 29-year-old young gentleman who presented with 6 months history of symptoms of worsening abdominal pain, severe constipation, bloody stools mixed with mucus. An initial colonoscopy showed ulcerated, nearly obstructing apical core mass at 20 centimeter, proximal to the anus in the sigmoid colon. This is the purple patch here. Initial CAT scan showed extensive feces in the colon with circumferential thickening, which is the language that usually radiologist tells you when they're seeing a cancer. He required resection of the sigmoid colon, and pathology showed colon cancer with 4 out of 40 lymph nodes involved. MSI, DMMR negative, again indicating non-genetic nature. His stage was stage 3C. When you take a look at his history, he was quite healthy, except for a colon cancer in his maternal grandmother, which is not his first degree relative, no other history to speak of. So stage 3C survival rate over 5 years is 53%. That's better than stage 4. However, you would recognize that this is way too much to deal with at age 29, either with stage 3 or stage 4 cancer of any kind. So why is this happening? You know, the old rules that we are all, as a healthcare providers, and rightfully always thought that we need to pay attention to cancer happening in older people. It is true, age is the strongest determinant of cancer risk. So the older we get, the higher the chance we are going to come down with a cancer diagnosis. But why are these green bars kind of rising higher? And this is from 2023. I'm old enough to remember when these bars were non-existent. And I can show you that in 2014, the proportion of new cases of people younger than 49 and younger was 10%. This has been rising for some time. Nowadays, 2 years ago, it was 13%. It's slightly more prevalent in young male than young females. Is this something that's happening only in the United States? No, it's a rising global trend. And as you can see, we are second to Australia, which has 13.5 cases per 100,000 people. And we are talking about young adults, so younger than 50, way younger than 50. Does Memphis have a problem? Yes, Memphis is a hot spot. There are, for some reason, hot and cold spots in the country with much lower and much higher incidence. And as you can see, this data held up even when adjusted for other variables. So maybe you will be surprised to learn that 5 leading causes of cancer deaths in the United States by age and sex, and to find out that colon and rectum is the second biggest killer in young people from ages 20 to 49. I mean, it's no surprise that colon cancer is second most prevalent mortality reason for somebody who is 50 and above. But, you know, for somebody who is from 20 to 49 as a second mortality cause, it's quite sobering to see. So as you can see here, people who were born in 1950s, only 3 in 1 million would be at risk for developing colon cancer. In 1990, that changed to 5 in 1 million. And born in 2010, we don't know yet. So I would like to show you a video. I'm really I like my mindless entertainment when I come home, and I watch a lot of 90 Day Fiancé, and this is a snippet that I recorded.
Video games have always been a part of my life. The game that I've been addicted to since I was like an early teenager. I have like over 20,000 hours on that game. Everything on board. I've been having like a long time ago. My life, I have spent so much time.
So around the time when I watched this, I came across the article that was dealing with the causes for young onset colorectal cancer. You know, it was fascinating and mind-boggling and shocking to see that the first and biggest cause in young people, biggest reason or risk factor for young onset colorectal cancer was sedentary activity, more than 14 hours per day. This is hazard ratio of 2.62. So as you can see here, our lifestyle has changed. When it comes to transportation in our original state, the only free ride you can ever get was on the hip of your mother. But now we have changed that from constant movement to zero immobility, as you can see here. I would say to people who are selling this zero gravity chair, which is quite pricey, it would be a marketing coup if they added a pack of free adult diapers to go with it. So can all that sitting kill you? 31% of global population is now inactive, which is negatively impacting their health. And we do not yet understand all the health risks posed by sedentary lifestyle. In the United States, it's 8 hours mean daily duration of sitting on our rear ends. Spreading of sedentary lifestyles is a global trend, and I would call it epidemic due to office work, TV, video, smartphones, social media, digital addictions, and transportation. So can all that sitting kill you? Yes, sedentary behavior causes wide-ranging adverse impact on human body, including increasing all-cause mortality. Physical activity is the fourth leading cause of global mortality, accounts for 6% of global mortality as well. It increases your risk for cardiovascular diseases, increases your risk for cancer, elevates risk for diabetes, hypertension, and dyslipidemia. It worsens joint problems and osteoporosis. It's associated with depression, and it's associated with dementia. If you ever wondered what visceral fat is, this is the area that I pointed out, the fat that is distributed in between your bowels, by the way. So this is the spreadsheet that I kind of, or graph that I laughed at. This is idealized version of how our days should be and how different reality is. As you can see, you should sleep 8 hours. You should sit 6, stand 5, have moderate vigorous activity of 2.2 hours and light activity of 2.2 hours. Who does that, I wonder? So sedentary behavior is risk factor for colorectal cancer incidence and mortality, independent on physical activity. And this is something I want to talk to you about in the next slide. How is that possible? Watching TV, occupational sitting, we all are watching this presentation by sitting. For example, total sitting time increases the risk of colon cancer. It's increased risk of all-cause mortality, specific mortality, and lower quality of life. So when I say that prolonged TV viewing is associated with increased risk, or that it's currently unclear whether you can overcome deleterious effects of prolonged sitting on colorectal cancer by simply increasing physical activity, you see, it's not the same thing if you're having this kind of distribution of your day versus like sleeping 8 hours and then you're working 8 hours from home. So you're on the chair again. So that's 16 hours. And then you watch your Netflix 3 or 4 hours. And then maybe you go to gym 1 hour. Is this enough to overcome the deleterious effects of sedentary activity? Yeah, you exercise, but it's probably not enough. So American Heart Association recommends 150 minutes per week of moderate intensity activity or 75 minutes of vigorous aerobic activity or combination of both. To that, you would want to add muscle strengthening activity or at least 2 days per week. Spend less time sitting, and even light intensity activity can offset some of the risks. So what is it we can do in our office? I'll show you in a second. Could regular physical activity protect you against colon cancer? The answer is yes. It reduces the risk by 20 to 25%, both in men and women, maybe even a bit more. Protective effect is found consistently in studies of various designs in diverse populations in subjects of various body mass indexes across various domains of physical activity. Maintaining physical activity before and after diagnosis of colorectal cancer also will decrease risk of dying of those people, of those patients, also risk of dying from colorectal cancer in dose-dependent manner every 15 MET hours per week. And this is, we are talking about 5 hours per week after diagnosis of colorectal cancer will reduce your total mortality by 38% and colorectal cancer specific mortality by 35%. Increasing physical activity levels following diagnosis of cancer was associated with a decreased risk of total mortality. How do our patients do who already have the cancer with physical activity? People always ask me, Doc, what can I do to improve my prognosis and outlook? And unfortunately, they always want me to tell them go to GNC and buy XYZ, but I tell them you need to exercise, get stronger. So patients who are dealing with cancer, just a publication in January, cancer patients with a high muscle strength or cardiorespiratory fitness had 31 to 46% reduction in risk of all-cause mortality compared with those with low physical fitness levels. It also will up to 41% reduce your risk of all-cause mortality in lung and digestive cancers. So I want you to forget colon cancer for a second. I want you to focus on doing physical activity for your overall health and enjoyment of life. Because without the leg strength, how would you do what you care to do every day? So here I'm showing you, well, if I could run this video, but I can't. This is where I demonstrated 5-time sit to stand test. And this is what you can do on an armless chair back into the wall, and you can go up and down 5 times. You see, if you do it less than 13 seconds, you're in good shape. If you need more than 16 seconds, you're at risk for mobility issues and falls. Can you do push-ups? Can you work on your core muscles? Amazingly, this video will work. I find it annoying when some people give me advice, but they don't do it themselves. So here I am demonstrating to you that, yes, you know, at 55 and above, you should do at least 10 push-ups. For women, subtract 2. Let me tell you, I did wash my hands after being touching the clinic floor. So physical activity will reduce your health risks and make you healthier. Now, let me talk to you about the effects of exercise on anti-cancer immunity. We have a pandemic with physical activity, and this is why I think young people are coming down with colon cancer, because immobility and sedentary behavior in my generation and older generations came only later in life. All fun was outside of home. Nowadays, all fun is on your mobile devices. So you have very quiet children who are just sitting on the couch and doing their iPads, and this is a global phenomenon. Of course, we are third in the world in terms of inactivity. 80% of our children aged 11 to 17 years is currently inactive, and regular physical activity is associated with lower cancer incidence. So 1/3 of adults fail to meet minimum requirements for activity. This is something that I want you to know. How about physical exercise and cancer immunity? This is the spreadsheet, or if you're a medical student, this is the layout of the immune system organs that are participating in immune system. You see here bone marrow, appendix, lymph nodes, tonsils, thymus, spleen, Peyer's patch. But which organ is missing, I ask you? Well, which organ is missing is the skeletal muscle. It's a forgotten organ of our immune system. And actually not exactly skeletal muscle. It is a contracting skeletal muscle. Only then it becomes an immune organ and participates in immune defenses of our body because it secretes a multitude of signal molecules called myokines. Those are small proteins and peptides produced and released by skeletal muscle in the bloodstream. All the organs in our body have receptors for myokines. They regulate metabolism, healthy body function, tissue regeneration, repair, immunomodulation. I would just mention here for immunity sake that contracting muscle releases a bunch of myokines, but most known is IL-6 or interleukin-6. It rises exponentially with exercise, intensity, and duration. And when released due to exercise, you cannot buy this in the supplement. You have to do it yourself. It elicits an overall anti-inflammatory effect. Exercise-induced IL-6 binds to natural killer cells, stimulate their acute mobilization to the bloodstream, and their homing into tumors. That's how you develop your superpowers to fight infection. So is your T cell lymphocyte like this? As you can see here, this little yellow cell is a T cell lymphocyte, and it's attacking the cancer cell. And in no time, 1, 2, 3 punch, T cell is done with the cancer cell, and cancer cell is gone and dead. This is what happens when you exercise. You mobilize your lymphocytes, and T cell is a T cell lymphocyte, by the way, during exertion, and this is proportional to effort intensity. And you push them out from tissue reservoirs. You basically get your surveillance T cells out from lingering and idling in your lungs and liver and spleen and into the bloodstream. When they're in the bloodstream, they could also be hanging and being lazy on the edges and on the walls of the blood vessels. Well, exercise and adrenaline stimulation will get them shaken off the endothelial, the lining of the, will shake them off the blood vessel walls and get them to work for you. So you definitely want to have, you want your T cells to be an attack dog, attacking intruder. However, you have to work with them as with every defense mechanism, whether military or our body, it has to be trained and taken care of. So going back to young adults with colorectal cancer, most of those young people are diagnosed outside of screening programs because there are no screening programs for young people having a colon cancer. And because of that, diagnosis is delayed. And because it's delayed, it's a later stage and they have a worse outlook. And some of them are fighting for their lives with metastatic colon cancer. It's predominantly left-sided colon. Genetics is usually not the reason why these people come down with this life-threatening malignancies. Most cases are sporadic. We would do well for these people if we understood what are the specific factors for young onset colorectal cancer. These would be very important to know because then we can build the algorithms to utilize it for secondary prevention. Secondary prevention is a fancy word for colonoscopy. Basically, healthy living is a primary prevention. Your colonoscopy is your backstop. It's secondary prevention. And also knowing exact factors would guide primary prevention. But even now I can tell, that's why I'm giving this talk. Please get off your chair. It's not good for you. Rise of young onset colorectal cancer is not only a United States phenomenon, it's worldwide. Causes are not fully understood, but we suspect inactivity, sedentary pursuits, unhealthy diet, and obesity. There are a lot of people who are talking about gut microbiome. I would say, yes, sure, investigate gut microbiome, but please don't forget what we already know, that that's a risk factor. And geographic disparities. We don't understand why we have hot and cold spots, but unfortunately, Memphis is a hot spot. That's an opportunity for all of us to save lives by raising awareness. What would I advise my colleagues and clinicians and anybody in healthcare? Please begin talking to young people who are having some abdominal problems by being more curious and ask them for more information. And ask yourself, could this young person be a high-risk individual for young onset colorectal cancer? Rising awareness contributes to early detection and cure and saves lives and improves outcomes. Clinicians should promote and explain benefits of readily available interventions such as physical exercise and healthy eating. And our screening algorithm needs update for prevention strategies based on specific factors for young people who are at risk for colorectal cancer. So in view of that, you can start right now. Since yesterday, Best Health offers Let's Get Moving Wellbeing Challenge. You can contact Best Health, Hannah, Leah, and get going with your activity and avoiding sedentary behavior. I would like to thank you by showing you the picture of me and my tennis buddies a couple of years ago. We are not any good. We suck at tennis. We probably kill more flies and mosquitoes by swatting the racket than make aces, but we do exercise and have fun doing it together.
Thank you so much for Dr. Jankoff. That was a great presentation. Got me up and standing. I was like, wow, you're always so motivating when you share this information. And I think it is so important for all of us to be aware of this and be able to share that with our friends and family. So thank you so much. I didn't see any questions in the chat, so we will get this recording up. Hope everyone enjoyed it and has a great day.
Thank you.